Tooth decay is very common, but to protect a decayed tooth is a real challenge. To talk about that, we have with us Dr. Jasneed, endodontist from Aster, Khor. Welcome to the show, Doctor.
Hello.
Doctor, before starting the session, if you can brief us about your specialty, it will be great, sir, because people who are watching, they might not know what exactly is endodontist.
Yeah. See, endodontist is a branch of dentistry that deals with the root canal treatment, especially deals with the disease of the pulp. Pulp means the blood supply and nerve supply of that single tooth. So, root canal treatment is basically removing the pulp, that means the nerves of the tissue, which is infected or damaged or decayed, and then completely sealing the root of that tooth.
Okay.
This is basically a root canal, what an endodontist does. So, it is a safest, a quick relief from your immense dental pain.
Okay, sir. Sir, if you can brief us about, yes, you have told just 2 lines about root canal. If you can brief us more, because people have always heard about the term root canal. Maybe they're not, beyond that, they don't know what exactly is the treatment. So, if you can just brief us about what exactly is root canal treatment.
Like I said, root canal treatment is a treatment that removes, deals, we are treating that root along with the tooth. So, we remove the nerves which is already infected, damaged, decayed, or in future we feel like it might go to it might die or it may go to a damaged state. In that state, we remove the nerves and we fill the root and seal it from further decay or further infections.
Okay.
So, this is basically root canal treatment. So, this root canal treatment is, it is not like what you do every day. It is like only when your nerves are infected by the decay or maybe due to a filling, which is caused by only by a filling. In some cases, we do intentional RCT. That means intentionally we are going to kill the tooth. We remove the nerves of the tooth. That is like maybe a part of sometimes a treatment, but that is very rarely we does.
Okay. So, is this treatment being very common? And just if you can let us know, like, is it a procedure very painful, or how long this will be, like a gist of all those things, doctor?
See, root canal treatment while doing, we have to give anesthetizing injection, we anesthetize that tooth and we does. But it is not compulsory that all the time we have to give injection. That depends upon the cases. If the nerve is already damaged and decayed, there is no point in giving injection. For some cases, the nerve already had been damaged. So, there is no need to give injection, but as a safety measure, we just anesthetize that tooth, then we start doing the procedure, so that the patient is completely free of pain.
Okay.
And the most advantageous thing is only the first visit requires the injection. After that, we remove the nerve so that the following 3 to 4 visits does not require any injection. Patient will be very completely comfortable. They don't need any other medicines or any anesthetizing, any other injection, furthermore injections are not required.
Nowadays, doctor, we hear that kids are under the root canal treatment.
Yeah.
So, if there are really kids who are coming to your OP complaining about this, and do you do this treatment for the kids also?
Yes, because the kids' tooth is completely different. They are called milk tooth.
Yes.
But as adult and milk tooth, when you compare the root morphology, the canal, everything is different. And the filling material also, it is completely different from the adult tooth. Why? Because this milk tooth root has to be completely resorbed. Resorb means by the eruption of your permanent tooth, the root will slowly disappear. It will just grind slowly by slowly and it will disappear. So that the material is entirely different. It is not that strong compared to your adult tooth filling material. Because this tooth root has to be resorbed and it should be gone. So why we are doing root canal in kids? Because we just want to save that tooth till that permanent tooth erupts. If we remove the tooth prematurely, the unerupted from the other side of the tooth will travel and it will block the underlying permanent, the tooth which is supposed to come into the real portion. That is why we try to maintain the tooth for a long time, lifespan. We are expanding the lifespan just to help the underneath permanent tooth to grow.
Doctor, you did mention about giving anesthesia during the procedure. So, how is it after the anesthesial effect? Is it painful, or how long will it last?
The anesthesia effect will last for 4 hours. That means it's gradually it come down within, whereof the effect will be within 4 hours. But in the first visit itself, we remove 90% of the nerves, and so that patient will get a relief, like around 98% of their pain will disappear. And by the second visit, we'll give a medicine for that the remaining 10 to 25% of their nerves to get cauterized. So it's a completely safe procedure. There will be no pain at all.
So can you just let us know about the benefits of the root canal treatment versus the extraction of the whole tooth?
See, for root canal treatment, it is the first choice, whereas extraction is only an alternative. Once you lose your tooth, there are many other problems. So you will have to go for a replacement of the tooth. That means you are going to pay more. Your treatment wise, your expense, it will be much more expensive. Whereas when you keep your root canal treated tooth, you can use, it will restore your function and beauty at the same time. So that will that function cannot replace by it can be, but the effect will not be as much as like your normal tooth.
Okay, sir. Sir, I know we have time limitations and you have just briefed us about the whole treatment. So, do you have any take-home message for the viewers who are watching? Some points from your end as a endodontist.
See, once if you go to a dentist and if he says you need a treatment, you better do it, because preventive care is much more better than rather than going for a treatment. Because when you go for treatment, it will be much more expensive, whereas preventive will be less expensive. And if you preserve the tooth, it will not go to a much extensive damage, which involves your nerve damage. So better try to every 6 months better go visit a dentist and ask the dentist whether do I really need a routine, go for a routine checkup, whether ask the dentist whether do I require any other dental treatment or not.
So viewers, kindly post in your queries related to root canal treatment and doctor will be answering all your queries. Thank you so much. Thanks a lot, doctor. Thanks for joining us.
Thank you.